Greetings, this is the coronavirus COVID-19 update for 3/15/2020. And we start out with the Chinese numbers. Cumulative diagnosis on the bottom left, 81,077, up 29 from yesterday in the whole country of China. Cures are up to 67,000. They say cure. We say recoveries. Most people just recover. 67,863. Severe cases 3,000 and cumulative deaths 3,000, up 14 from yesterday. And then as you scroll down this Baidu page, there's a link in the description below. You can see they're putting together a map, and they've changed their map several days ago, and now it reflects the number of cases minus the number of cures. So you see a lot of provinces in China getting lighter colored. Then if you scroll down further, you see the first graph. This plots deaths in black and additional recovered cases in blue, and suspected cases in gold and diagnosed cases in red. And you can see the suspected cases and deaths and diagnosed cases are all in a general downward trend, which is good. And this is new confirmed cases, and this is a little bit different than usual because most of the new confirmed cases, 25, come from outside of Hubei province. Only 4 in Hubei and 29 national. National is in the red. And this is the third graph, which shows the number of new cases in China, which is 29. Plotted against the rest of the world, which is 9,751 new cases today. So that's a pretty drastic difference. China gives the virus to the whole world, and now the whole world is in bad shape. And if you scroll down further, you can see a list of provinces, and I usually open this up under Hubei to see what city they're from. The 4 are from Wuhan. And the new cases are just scattered, 2 in Shanghai, 1 in Beijing. So that's what makes up the 29, is just scattered throughout the rest of the provinces. Then you see a global map, but this is not very accurate and never up to date, so I don't use it. And then we see the hot search topics of the day, and these are search terms, so you can't always read the search terms and figure out what they're talking about. You have to click into these and see the stories. So we'll take a look at these. The first one is, this is a festival going on. So there are some provinces in China that are lifting restrictions on gathering, and this is a performance going on. So that's good to see. Upper right, Information Office of Hubei, and they're announcing that for non-COVID-19 or coronavirus patients, they're announcing some new online things where you can, talk to a doctor online about your sickness and get treated. But, this is just probably because they ignored these people for a long time because Hubei had other things to worry about. Bottom right, Wuhan announces selling reserve meat. This is, I've looked this up on several news things. The topic is always, doesn't make much sense. But what this is about is, this is in Wuhan, and there's some markets opening now. So they're talking about reserve meat. There's, some of these people had a pretty big buildup of meat and other products. The vegetables from a month ago probably wouldn't be any good, but if they kept the meat frozen, then it should be in pretty good shape. So they're opening up some markets now, and you're allowed to, move around inside of Wuhan. Wuhan was strictly relying on restaurants and grocery stores to deliver food to the, millions of people who live there. And what else? We have some global news here on the left. There's a defender, soccer player or football player who came down with coronavirus. In the United States, most sports have shut down. The NCAA tournament shut down, NBA shut down, and baseball season is suspended. And on the right, this is a Chinese doctor that you're probably used to seeing, and he just came out and said it's unlikely to end this summer. By the way, he predicted a couple of weeks ago that there's going to be another outbreak in mid-March, and I don't know what that's going to come from. People who tested positive all of a sudden showing up, or tested negative showing up, with coronavirus or what. But it's mid-March. Then what else do we have? New York teachers agree to collective sick leave. Well, this is a little bit dated. That did happen. That was the news yesterday or early today. And then finally the state of New York shut down schools. And on the right, this was about a guy, Wong Tao. His father and cousin were both killed in the collapse of a quarantined hotel where too many people were staying there. So many that it collapsed the hotel. That's a little odd. I've never had a fear of a hotel collapsing if too many people were in it. But that happened in China, and it killed a lot of people. And this guy just went back today to pay tribute to his father. And this is not a good video on how to wear a mask, because this mask isn't doing this guy any good at all. It doesn't seal the air around his nose, and that's not how you wear a mask. Then we go to the Center for Systems Science Engineering, which is a research institute at Johns Hopkins University, and they show you the global numbers. And this is the site that most of the world uses. If you've seen some past videos, you can see Italy and Germany where people are coming together in a room, and this is on a big video in the back. So everybody uses this tracker because it's really good. So the new numbers for today: 167,811 and 6,471 deaths. 76,000 people recovered. Almost all of that is in China. And the first thing I do is take a look at the numbers from Baidu for China to see if it equals Johns Hopkins, and it's pretty close. It used to be off several hundred, but it's been close lately. Then I take a look at the 3 global hotspots, which anymore there's other countries that are really trying to catch up with these 3 global hotspots. But these would be Italy, Iran, and South Korea. Now South Korea started as the biggest outbreak outside of China because of this big Christian church sect, whatever you want to call it, with 450,000 members and 1,000 churches all over South Korea. And they were recruiting people out of, guess where? Wuhan. And some people at the church got infected and didn't know about it and got together in really big numbers. So South Korea's numbers started to escalate up to several thousand, within a very short period. But since then, they've really got it together because it hasn't increased much lately. As you can see, yesterday, 80.86 to 81.62. But Italy is very, very bad. 21,157 yesterday to 24,747 today. And if you look on the right, Italy has 1,809 deaths, which is crazy, crazy bad. Way, way worse than any province in China except for Hubei. And they were at 1,441 deaths yesterday, Italy, up to 1,809. A lot of people dying. And in Iran, you don't know what to believe, but these are numbers coming from somewhere. Now this is news out of Italy, news stories, and the first one we see on the upper right, victims 1,809 and 368 deaths in one single day. That's a new world record. On the bottom, Italy sees the biggest COVID-19 toll in a day as global deaths pass 6,000. And then there's news coming in from the government. Coronavirus 25 billion decree, 350 billion leverage expected. So they're setting aside some money for fighting coronavirus. And on the bottom left, that's the story from yesterday where they said, don't even return home if you're outside of your city. But they relaxed that a little bit today and said, yeah, you can return home. Just, go straight home. Then the news out of Tehran is always the same every day. These guys are blaming, U.S. sanctions on the condition of the country, where that's a little crazy. The sanctions are there because you sent a general to Iraq to round up some terrorists to kill Americans in the American embassy. So guess what? We killed him with missiles, 2 miniature missiles in each car, and killed his little 2-car caravan. And then you guys in Iran, your government, shot down a commercial airliner. That's why you have sanctions now. And the reason you have a virus that's out of hand is, the photos on the lower left. Zillions of people gathering in a little mosque, a little religious site, a pilgrimage to calm the city where, people slept together in really close quarters and ate together in really close quarters, and then they visited this religious site in really close quarters, shoulder to shoulder, during an outbreak. And there's even some idiots here who are licking the sides of the religious site, just to show you that they're not afraid of coronavirus. I'm going to lick everything I see. Well, these people have been arrested now, and they're facing flogging and jail time. But, that's the reason you have an issue. Has nothing to do with sanctions. If you guys can make nuclear reactors, you can make a mask, okay? Get off your butts and start doing something. You don't need the sanctions relieved, taken away. Korea. Okay, the bottom left, or the slides across the bottom on the left side, I've left that up for a couple days now because South Korea is starting to give some advice to the rest of the world. Why? Because they went up to several thousand cases, and since then it's only been increasing like 100 a day, where if you look at the rest of Europe, there's places that are increasing several thousand a day. So they have things under control, and the way they did that is spraying down everything, disinfecting everything in public. They didn't shut down anything in the country. There's no shutdowns in South Korea. People are allowed to walk around, and they also, invented this, we'll test you in your car. We'll scan your driver's license and swab your mouth and test you as you drive by. Thousands and thousands of tests every hour. And on the lower left, they recommended some drugs, and HIV and anti-malaria drugs for COVID-19. Both of these are in the same pill, and the pill is called Kaletra, and the drugs are lopinavir and ritonavir. Those are 2 American drugs, and the new drug Kaletra is made by AbbVie Labs, AbbVie Incorporated, which is a spin-off of Abbott Laboratories. So this is what they're using to treat people, and they also have more people recovered than any other country except for China. But they have more recoveries every day by far than new cases, so they're really doing something that the rest of the world should follow. New news today: tougher health checks to arrivals from all European countries. That's a good idea because Europe's out of control. Lower right, 74 new virus cases, totaling 8236. So it's a little higher than what we show on Johns Hopkins at 8162. So that's the 3 hotspots, or what used to be the 3 hotspots. Now we have more hotspots: Spain, Germany, France. So Spain, this was a story from yesterday that I left up there. I'm going to try to leave a small picture of the story from yesterday. These are drones operated by police, and they're going around looking for people. So the police are looking on a video, and if they see people, they'll lower the drone and use a recording to tell them to get off the streets and go home. Coronavirus, what you can and can't do. So this is a list of things that you are allowed to do and not allowed to do, and it was pretty interesting. You're allowed to walk your dog, by the way. Out of Germany, it's really hard sometimes getting news out of Germany. These are the 2 biggest sites that I know of, and I've lived there. So Der Spiegel is the Mirror, and it just has a story, closed society. So Germany is closed down now. And from the Welt, Germany will control several borders starting on Monday. No specific information here on where the virus is, but there was a chart in yesterday's video that shows the provinces that are most affected. There's mostly 3 provinces. And this is from yesterday also, because I left these sites open and I just refreshed the screens, and there's really no new news for Switzerland, Norway, Sweden, Netherlands, and Denmark. So no new news to report. So this is the US of A. We are up to 3,774 cases, and deaths were up from 54 to 69 deaths. And what's really bad about this is the total recovered on the right, which is only 12. Why do we have so many of these, thousands of people still in the hospital? And what is the CDC doing to oversee this and try to figure out whether hospitals are, giving the right treatment to patients? And if you look on the lower right, this is a crazy graph that I don't know what it is. If it's total number of cases, the scale on the left is wrong because we're up around 170,000, not 90,000. And if it's anything else like recovered cases, the green line says total. So that should be the total of the orange line and the yellow line. And it should be higher than the other 2 lines. So I don't know what they're doing there. I don't use it. And then the big news out of the United States today is the government came out and said that a vaccine trial will start on Monday. Now, this is not a clinical trial, but it's good news. I mean, they didn't say which laboratory did this, but whatever it is, somebody got a vaccine ready already, which is very impressive because, it took a long time to get the actual virus from China, because at the time we started working on it, we only had like 6 cases. That's not enough to do any kind of trial. It's not enough, virus to start messing with. So somebody got this ready, and that's pretty impressive. Now, I don't know what kind of vaccine this is. Lately, vaccines for coronaviruses means they take the virus and they mutate it, and they do that by putting it in a chicken, and somehow they let it mutate to where it won't attack human cells because it only knows chicken cells. And you put it in the human body, even though it's a live virus. Not all vaccines are made of live viruses, but the ones that are made out of mutated viruses. And the human immune system sees that and says, "That's not us. Let's attack it. Let's kill it." And it can affect human cells, so that's the way that works. I think this might be that type. Then news out of California, Ohio, Illinois, Massachusetts, and Washington have closed bars and restaurants, which is really good. Some of these states are really being proactive. California already has a bunch of cases. So does Washington. Illinois is kind of mild. Ohio only has 37 cases, and they shut down bars and restaurants. So really being proactive in the fight. And then this is a graph that I make, and if you take a look at it, it's scary. So yesterday, we went from, well, if you just take a look back to, like 310, 971, from there up to 3774, the graph is curving upwards. So it's not an arithmetic, linear graph. It's curving up. It's a geometric graph. So that's really bad news. And, we're in pretty bad shape. Okay, appreciate your time.